So this is Journal 12. This week I was with women's basketball, and they are a relatively pretty easy team to be with. This was my last week with them, so I go back to my first preceptor, who I was with in the beginning of this semester. So I'll be with swimming and some baseball rehab and stuff like that starting Monday. This weekend I did my emergency department rotations. That was really fun, but I think that the whole point for us doing that was to kind of get the, thought process of, in an emergency, what do you go through? Stuff like that, how quickly things have to be, the golden hour in their perspective, compared to an athletic trainer's perspective of the golden hour, because as an athletic trainer, we are there at the start of the golden hour. And if EMS takes a while to arrive and, the hospital or the emergency room is so far, like, a certain distance away, that time is really important. So when it takes a patient or athlete that's been in an accident or something, and it takes an hour for them to get to the emergency room, and last night particularly, we had an older woman fall, and they called in, so we reserved a bed for them in the ED, and it took them an hour to get her there. And at that point, she fell out of her bed and had some left hip pelvis pain and a pretty gnarly skin tear. She was 95 years old. She's also was in a mental facility, so her behavior could go back and forth. So before arrival, we really didn't know what to prepare for. But x-rays came back, and her acetabulum was fractured. She had a pretty significant, she couldn't describe her pain, but you could palpate along that side, and lots of complaining, facial expressions, that stuff. But when it came to stitching up her skin tear on her left forearm, it was hard because they didn't know how long she had been sitting on the floor before someone came back there to find her. And then it took them at least an hour to transport her to the emergency room. So the skin around, the outside where it had ripped was jagged, and the doctor actually asked my opinion and was like, I don't know what to do. And I said, well, since it had taken so long, if he would have sutured that skin back, it just would have died. So it would have longer healing process. So we came to the conclusion that we should make a clean cut around, take all the jagged edges off, because it wasn't cleaned very well. so infection was a huge thing anyways. But he cut the jagged edges off, and we kind of just pulled the skin back together and sutured it. He ended up stitching her for almost 2 hours. After that, we had a lady that had dementia. She didn't remember what happened. She couldn't move her thumb at all, her right thumb. She just kept telling us that it hurts, it hurts, it hurts. No one was with her when it happened, so we don't even know what happened. So we did a portable x-ray, because every time we would get her up to put her in the wheelchair or anything like that to take her to x-ray, she wanted to undress. So we left her in the bed. We brought a portable x-ray machine down to the ED and x-rayed her hand. In her MCP joint of her thumb, it was a pretty significant dislocation. So, I actually got to help pull on that one. The doctor held probably like this way from the other side, and I held here and just kept pulling and pulling, and we took probably 3 portable x-rays to get it back in. I had never done that before, obviously, so it was really hard to tell if I was hurting her because I was doing it wrong, or if that was how it was supposed to be, so I was kind of hesitant, especially, I was just there to observe, and, they were like, here. I mean, my mom was an RN and stuff like that, so I know how stressful it is, I guess. The RNs were not very happy with each other anyways. They weren't speaking. It was, very weird, vibes, I guess you would say, with each other. Because if someone needed help, they did not want to help you. They only wanted to take care of their patients and their patients only. Also, there was a man with a distended belly, pretty significant distended belly, but he came in with chest pain. Apparently his belly has been like that for 2 years. He does not have insurance, so they do not want to get that checked. So, I mean, you kind of have to respect that. But the chest pain was acid reflux. But our question for this journal is, what has been an unanticipated challenge for me as an athletic training student? And I thought about this for a while, actually, because I did anticipate for this to be difficult and stressful and definitely make me question my time management skills, but I think I have toned that back in, finally, thank goodness. But I really do think that I didn't anticipate how quickly I would be going through things in class or in lecture, and then being in the clinic and they're like, oh, you learned this in class, do you want to do this? And that really freaks me out still, and it happened the first day of class, and I was like, what? But just the sense that after one class that I need to know it and I should be able to do it really kind of scares me. I definitely do take a little bit of time to grasp topics and subjects and stuff like that. So that I really struggled, still sometimes struggle with that. Definitely in our lower evaluation class, because we started off with hip and lumbar. which everyone says is hard, and I believe it is very difficult, obviously. We spent like 2-3 weeks on hip and lumbar, and there's like so many special tests to remember. But a athlete would come into the clinic and preceptor would be like, you can do lower evals now, and I'm just like, oh goodness. But along with that, I think that I'm still adjusting, so usually especially last year, when I wasn't in major specific classes, I would study to remember information for the test, for the exam, and then after that, blank. I have been trying to be better about making my study ways stick so I can find ways to remember stuff along with other injuries, how to remember special tests with whatever pathology that is, because we're learning this stuff and you need to know it forever. If you are going to be an athletic trainer, you need to know everything that we go over. And I also think that my clinical class is really struggling with this as well, but I also think it's part of our learning curve. But I have caught myself like forgetting things, especially in modalities class. But I have tried to make it a habit to just like when I have time, review, read over some notes and stuff like that. It's always good. Going through the clinical book, refreshing memory on things that I've done has really helped me remember stuff. But I definitely think that was one of my biggest challenges is learning how to study to not forget. Like learning how to study to not just temporarily learn something. But I'm excited for week 13. We're getting close to the end, which is kind of scary. Kind of stressed out about it, but whatever is going to happen is going to happen. So, just gotta go with the flow. But I'll be back for 13. Bye.